Okay, we are live on YouTube.
Okay, good evening and welcome everybody to our older adults issues, housing, health, welfare committee meeting. And tonight we have guests and look forward to hearing from all of you about your organizations and what kinds of services you have to provide to the community. My name is Ruth Greenfield Mazer, and I'm the committee chair. So thank you for all for coming tonight, whether here or on Zoom. And so I see that Karen Tadros is here, and we'll call on you first since you were here first.
Hi, Ruth. How are you? Hi.
I'm good. Thank you.
Good evening. Thank you, Josephine, for giving me an opportunity to be here tonight. So for those of you who are not aware of Bay Ridge Cares, we're an organization that has been operating in Bay Ridge for about 13 years. And our biggest impact as far as seniors are concerned is our Thanksgiving meals program. And we've been providing Thanksgiving dinners to homebound seniors since our founding back in 2012. We started this initiative by providing about 15 meals our first year out. And this past year, we delivered 800 meals.
Oh,
Well,
So it's grown substantially over the years. And just as an example, the year before, in 2023, we did 650 meals. So in a year, we went from 650 to 800. So that's a huge leap. We probably will see a substantial leap again this year. Hopefully we can, take those numbers and grow them. But a lot depends on, of course, our funding, because we do pay for those meals. They're not donated. And we have to make sure we can cover the cost for those. We do hope we can. Our funding so far looks like it's there. We are waiting for, like every other not-for-profit in the city, waiting for our funding to come through from the city from 2024. It's being held up in limbo, but our fingers are crossed that those funds come through before Thanksgiving. But our volunteers are always ready and willing to make those deliveries. And so we want to make sure that the word gets out there that if you know of homebound seniors who can't afford a meal, it's that they don't have to be homebound if they can't afford the meal. If they're going to be alone for the holiday and have no place to go, those meals are there for them as well. Handicapped people, disabled people, they don't have to be seniors. Veterans, these are not meals meant for, just seniors. These are for people, anyone who needs one. We don't ask questions. We assume if you're calling for a meal, you need a meal. So it's no questions asked. So we just want to make sure everybody knows there's no fee for this. We don't ask for a dime. A lot of people want to know, could they tip our drivers? No, you can't. We just ask if you want to make a donation someplace, go right ahead. But please don't tip our drivers. But they're all volunteers. It's a full meal. It comes fully prepared. All you have to do is heat it up. The next day, you get it the night before Thanksgiving. And we're here to do it. Like I said, if you know a senior, if you know a neighbor who's going to be alone, just we put out the information November 1st. And if you check our social media, even community board gets a notification. You can put it out through your newsletter. Catholic Charities, I know, gets involved. We sometimes get a lot of their clients. The Bay Ridge Center, we get a lot of their clients as well. So we try and get the information out to as many organizations that have seniors that they service. So We'll get that information out there again. But again, if anybody out there is listening on YouTube or at the meetings, please check our social media November 1st and let us know. We're happy to help.
Karen, I have a question. What is the geographic boundaries? Does that change each year or is it?
No, it hasn't, Josephine, actually. We start at Shore Road, we go all the way down to Bay Parkway,
Okay.
and we go to Shore Parkway all the way to 65th Street. So normally our service area is usually Bay Ridge. This is the one initiative where we go beyond our boundaries and go beyond the scope of our catchment area. So yeah, anywhere out in those lines is where we service. So beyond the Thanksgiving program, though, I do want to let everyone know, though, that during the year, Bay Ridge Cares does not just fill seniors, service seniors at Thanksgiving. We get a lot of calls from seniors, especially who this year alone, a lot of seniors had their SNAP benefits stolen. They'd go to the grocery store, buy some groceries with their SNAP card. They'd go back the following week and all their benefits had been stolen off their card. And we would get a call that they had no more benefits for the rest of the month. So we provided, yeah. And it was happening at some grocery stores here in the community. And so what we ended up doing was, on a number of occasions, providing groceries to a number of seniors for the rest of the month. And, we've had a number of veterans in the community whose SNAP benefits run out late in the month and they have nothing left, senior veterans. So throughout the year, we are constantly filling refrigerators for seniors who run out of groceries. They don't have money for groceries, and we're happy to do that. They give us a grocery list, we place an Instacart order, and it's delivered directly to them. They never have to leave their house. Someone is ill and they can't get to a grocery store, we're happy to do that for them. So we want the seniors in the community to know that Bay Ridge Cares is there. That is what we do. First and foremost, we are there in case of an emergency, and we're happy to do that. So please keep us in mind if you know of any seniors going through emergency crisis. If something should happen, just give us a call. You can find our information online through our website, on all our social media accounts. Our phone number is there. You can give us a call. You can send us an email. We're happy to jump in.
Anybody have questions for Karen? Well, Karen, I remember when.
Very,
Oh, go ahead, Stella. Sorry.
very nice thing to do, because you never know who might be in that serious need. From one day to the other, things change.
Absolutely, Stella. Absolutely.
It's still an idea to help these people that really need the help, wherever they're coming from.
Yep, absolutely. And we do, I'm sure it is here from Catholic Charities. Karen Calvarino over at Benson Ridge Senior Services, and I have a
Yes.
really lovely partnership. Karen has called me on a number of occasions.
Yes. I was
and
going to
we
say
jump
that.
in.
Yes.
Yes. Yeah.
Thank you so much, Karen and Karen.
Yeah, the double Ks.
The double Ks.
Yeah, we've jumped in on a number of occasions and helped her out. We've gotten calls from the Department of Veterans Affairs right here in the community. They've gotten a number of veterans who have been in dire straits, and we've jumped in and always provided food for them. Things happen. You never know. Like Stella just said, you just never know 1 minute from the next. When a situation, you can become unemployed. You never know. Many years ago, even just as an example, when the federal employees were furloughed, and we're going to have this situation again in the community, we provided grocery cards for all of the local federal employees that were furloughed. That is the stuff that we do. And we're going to have this situation coming up again within the community. You know, I don't know if many of you know, but there were some major federal cuts to veterans programs that were made last night to the tune of $2 billion, mostly to their health programs. So we're going to see that happening. An $880 billion cut is coming to Medicaid, and most of that is going to affect most of our seniors. So we're going to see, you know, some major problems for seniors coming down the pike. Seniors in nursing homes are going to face some dire situations. Their Medicaid is going to be, you know, Catholic Charities is going to know a lot about this, especially in the nursing homes. I'm really concerned. We're a naturally occurring retirement community here in Bay Ridge. Our seniors are going to face some really dire situations. And so as a community, we're going to have to really band together to try and solve some of these situations. Our seniors, a lot of them are poor in private. We go into some homes and we open up refrigerators. Guys, I can't tell you how many times we see empty refrigerators. So many of our seniors are living in squalor. It is a sad situation, and I can't imagine what is going to happen to some of them. So as a community, I want you, everyone who's listening out there, if you know of a senior who's going through problems, please, Bay Ridge Cares is here for that reason. And going forward, I don't know what the economic climate's going to be for our seniors. Please keep Bay Ridge Cares in mind. That is why we were formed. That is why we exist. And that is why we are here. So thank you for the opportunity to present that to everybody.
I think Danielle, you have your hand up.
Yeah, hi, thank you so much for this. I just wanted to ask, is it that people have to contact, the senior has to contact you directly, or can we refer somebody on and you connect with them?
Yes, so Danielle, it can go either way. We have an online aid application on our website, bayridgecares.org. Or if you're a social worker and you know of a senior who's going through it, they have to be in Bay Ridge. That's one thing. But if you have a senior who's going through crisis, you can call us directly and we'll have that conversation. If it's something we can help, we'll put the process up, filling out the application together, and then we'll take it from there. Our aid committee will take a look at it, see where we can help, and we'll take it from there.
But you need to be a social worker to refer someone to you.
Oh, absolutely not. A neighbor could do it. A neighbor could do it.
Okay.
Anyone can do it. Absolutely. This is not a social worker situation. The neighbors are our best eyes and ears. When our Thanksgiving volunteers go out to deliver their meals, we ask them to be our eyes and ears in the community. If they see something, say something, because we don't know what people are going through, but they can ask, do you need anything? Is there any way we can help you? That's the best way for outreach. Show a little compassion. We're still neighbors. We should still care. So
Any telephone number just in case someone to send things, volunteer services, or wants to ask questions? Can you project the number? You'll give it.
I can do that, but you know what? The funny thing is, Stella, I don't even know our phone number off the top of my head. So I will look it up.
Okay.
Hang on one second. How silly that I don't even know.
You never call yourself.
I never call myself.
Yeah.
You're absolutely right. I never call the Bay Ridge Cares phone number. Hang on one second. Oh my goodness.
Maybe you could give it to us when you find it, okay?
Yeah, I'm getting there.
We'll move on. But I have a question for you, Karen.
Sure.
How do you get your volunteers, and are you looking for more?
We are always looking for volunteers. So we have on our website, again, there's a volunteer tab. and you can fill out the information. And anytime we have an event or a need for volunteers for one of our initiatives, we send out an email with the sign up roster and people can sign up. And currently we have about 800 people who have signed up to be volunteers with Bay Ridge Cares. Not everybody has availability for everything. So, but when they do, they sign their name up and they're available. So depending on what's going on, they're available. There are some things we ask for, Thanksgiving is one thing where the whole family can get involved, children. We love when the kids get involved. We have Earth Day coming up, where we tackle the environment in a park, and that's a whole family day event. So depending on the initiative, sometimes it calls for adults, sometimes it calls for families, sometimes we never know what it might be. So, but on our website, there's a volunteer tab. If you go in and click on that and sign up, we'll be happy to have you.
And your funding, does it all come from the city?
No, we get about, we do get a lot of private donations. It's a little bit of both. Thank God.
Yeah.
We get a lot of community support and we're grateful for that.
Well, thank you. As a Bay Ridge resident, I've seen Bay Ridge Cares start and develop and grow. And I think it's amazing. It's a wonderful organization, and we're very, very lucky to have such dedicated people in our midst.
Thank you, Ruth. I
And
should
you
say,
do a lot more than provide food too.
yes,
Oh,
we do.
yes.
We definitely do. Just as an example, we give, we provide backpacks, about 400 backpacks to kids for the school year. We do a holiday wishes program. We surprise about 15 families who are struggling around Christmas time with some cash. We ring their doorbell. We'll like Publishers Clearinghouse and surprise them with some cash. Again, we had a bunch of fires in the community over the last 6 months.
Yeah.
We arrive and hand those families cash, emergency cash, so that they can go out and get what they need immediately. We don't ask any questions. We just arrive like the Red Cross, except we give a little bit more than the Red Cross. We do a pajama drive where we provide pajamas to homeless shelters and to the domestic violence shelter here in the community. I could go on and on with the amount of initiatives that Bay Ridge Cares does. But if you've never heard of us, look us up on our website. You'll get a whole briefing on what we do and how much we've done. Follow us on social media. That's where you'll find all the things that we do. And join us. Come out and play with us. You'll have a fun time too. And you'll meet a lot of your fun neighbors too.
Many people, elderly people or people who belong to the old school, as we call, they need the number, they need the contact
Yeah, I'm
information.
looking.
If you don't have it now, send it to the board and we know how to get a number from them.
Yeah, it's here.
I'm sure
That's all right. We don't have to take
we could ask Joseph.
time from others. Yeah.
Yeah, no, I'll send it out.
Well, I was thinking, we could ask Josephine to add it to the next CB10 newsletter.
Yeah.
I got it.
good.
Contact information for.
I have it. I have it.
Okay, yeah.
It's
Sure,
it's
you
not-
have it.
yes, it's
Well,
917.
you have a phone.
Yep,
Your service-
917.
Wonderful services, by the way.
Thank
Wonderful.
you. It's 917
Good. Yeah.
382 4608. And you can always reach us by email at bayridgecares@gmail.com.
Great. Thank you so much, Karen.
Okay, thank you for having me.
Thank you. So, who would like to go next? Sure, would you like
Yes.
to speak about Catholic charity?
Hello,
Hi,
Hi.
Shura.
thanks for the invitation. Shira McCletchy here. I'm one of the social work supervisors at our program, Benson Ridge Senior Services. And we are also in Bay Ridge. Our office is in Bay Ridge. We cater to our catchment areas, obviously Bay Ridge and Bensonhurst. And the client must be 60 and older. That's part of the criteria. We are funded by the New York City Department for the Aging. 60 and older, and if there's maybe you don't have support in terms of helping you with food, make a hot meal or those things along those lines, or maybe you don't have cooking utensils, or there's some kind of maybe mental issues going on or physical issues, you can't get out. Department of Aging deemed you have to be homebound. That's one of the criterias, but it doesn't mean the client can't walk a few blocks maybe to get, some shopping done, but basically they have to be homebound. So our program also, besides you get a hot meal or frozen, depends on what's happening, because we have so many clients. Sometimes they have treatments during the week, so frozen might be more appropriate. So we have frozen meals, hot meals. You get 7 meals for the week. On the weekend, we provide, for the weekend there's frozen and a chilled, but we have different types of meals now, cultural meals, halal meals, Chinese meals, Russian meals. So hopefully that grows into other types. We have it's a small office in Bay Ridge. We are not a walk-in center per se, but clients see the sign and they always, or people that are interested, they come in and they ask. We always give them information. We can, we have our case managers, social workers, they go out to the homes and they try to get more of a comprehensive picture of what's going on, because sometimes besides the meals, sometimes the client may need other benefits and entitlements. We can help them with Medicaid, of course, SCREE, HEAP, food stamps, and other benefits. So we have those. We can always link them to if they need a elder care attorney, things like that. That's another big thing, because sometimes you have a senior living in a home, or they've been living in Bay Ridge or Bensonhurst for many years. They may want to start to explore Medicaid, long-term care, and the house. What can they do with the house? So we can always, we have links and referrals to that. So other things we offer besides the meals, we have home care. It's limited, it's 20 hours a week, that's the maximum. Home care, or we have housekeeping. Then we have other services like friendly visiting, telephone reassurance. Obviously, it's well documented, the senior. We try to get them engaged because of many loss and different emotional situations they may be going through. Many loss, of course. Loss is a big, loneliness, things like that. So we try to connect them. Mental health is another area. We have links to that, agencies, even an agency we, right downstairs on Fifth Avenue where we are, and 69th Street. We have a program, it's a Geriatric Alliance Services. So that is one we can always, up to the client if they want to be connected to mental health services. We do that also. So it's quite a lot we do also. And APS, of course, if there are issues beyond us, we will refer the client to APS, Adult Protective Services, as needed. We never turn clients away. We always try to help them, but of course they are in charge. They know what they might need, or if they would like, we ask them. They're adults. We treat them with respect and dignity. But, we always ask first if this is something you'd like to explore. If not, we give them information, and they might say, okay, maybe later on or something. They could always come back and explore it. So these are some of the areas and the services that we provide. We have I believe is over 600 clients. And, they are our clients, yes, and there's similarities, but everybody's an individual. So when the worker goes out, they use their tools, all their senses, try to get an idea of what's happening to the client and if they would like to address it. And we go from there. It's very comprehensive. With the state, in the last, I guess, before the COVID, there are more things to sign and more questions, but it's because they want to get an idea of the client in their home. What can we do to help? So, and we also have staff that speak different languages besides English, Spanish. We're working on some pamphlets and brochures and other materials, Arabic, Chinese, Mandarin. So we have a worker that speaks Mandarin. We have one that speaks Spanish. So we try to get that because of our area, the need in the area. So that's what we can offer. We never turn anybody away. We always try to, even if it's just information, someone is passing and they stop, as I said, they see the sign, they want to get information. We'll go upstairs. If we don't have it, we'll do some research on the computer, print it out, give it to them. Or if anybody's underage and they're passing, and I know we're going to speak about housing, which is a horrible issue. It's just awful. We don't have enough senior housing. So sometimes people pass by our building and they want to get information. Those, even, much younger people, we would give them information for our main office which is in Brooklyn Heights, Gerolman Street. There's a walk-in center that can help them with housing as much as they have that the list is open, immigration, and other things like that. So it's quite a range of, as you know, Catholic Charities has probably close to 200 programs or maybe more. So there's a lot, and we also celebrated recently 125 years. So
Wow, that's incredible.
yeah, it's been going on for a while. So, just try to cover as much as you can, from infant, I guess, to, to the senior population where who I work with. So that's it in a nutshell. I mean, you can always call the office. And the first step is, as we mentioned before, anybody can call. Sometimes people call, they see the truck in the area, in the neighborhood. A neighbor may notice something that's not right with somebody next door. They don't look right, they haven't seen them, and if they do, they don't look right, something is off. They call the office, we go right away. I have gone out on several visits like that. Somebody in the neighborhood, they might not even be a client, but you are in our neighborhood and we will check it out. Try to get help, try to get the family, ask questions, and try to address as much as we possibly can. So that's what we do. And it's never 9 to 5, it's never 9 to 5. We go beyond that. Sometimes we go out on a visit. If there's a no answer for the meal, we go out. We wait. Sometimes we have to wait a little bit because sometimes there may be a situation where someone may have a key, and that's right, it's very important for us when we do our assessment. Always try to get contacts from the client and who has keys for emergencies. So sometimes it might be a friend, a neighbor, the super, or sometimes we have cases where there's nobody have a key. So that's where, we have to try and be creative and try to get into that apartment and make sure the person is not on the floor. And unfortunately, I, from personal experience, have found clients on the floor. So we take that very seriously. If there's no answer for the meal, we get on the horn right away. We call the clients, we call the contacts, the family, if they have any friends. We go through the whole list. That's by a certain time, we go out, and then we know we have to call 911 and start that process to make sure the person is safe. So sometimes it's just the Meals on Wheels person showing up, the driver showing up on that day. Sometimes the person doesn't have another soul in the world. No other connection but that person that's bringing the meal. So sometimes you can say it's really more than the meal. It's the contact, that social contact. So there's a lot that we do, and we're very proud of our program. I'm very proud of our program because we save lives more than you realize. So I'm grateful for that. So as I said, anybody can call the office Monday to Friday, 9 to 5, or if you feel, they want to call on the weekend, leave a message. We'll get back to you Monday morning. We have social workers and we have case managers, and they're all excellent, mostly veterans we have in the office, very knowledgeable, very skilled, and I'm proud to work with them. Thank you.
Thank you. Does anybody have any questions for Shura? Yes,
Hello,
Julie.
Julie.
Hi, how are you, Shura?
Good. Thanks, Julie. How are you?
Good, thank God.
Good. Thank God.
So, question, I just was wondering what your boundaries were, because I know years ago, my father-in-law, may he rest in peace, he was in Long Island and actually needed kosher meals from him, and we were directed to contact Catholic Charities for the kosher meals, which I found very funny. But they provided them,
Right.
and that was on Long Island. So I was wondering how far, what your
With the
radius
meals?
is, how far you, or for anything, like where is it New York City? Is it like, and Long Island, just where?
Our catchment area is Bay Ridge and Bensonhurst.
Okay. All right.
Right.
So that's
Yeah, our
regions.
program. Yes, our
Okay.
program.
I did not know that.
Yeah, for the meals,
Okay.
that is where our catchment area is. If anybody calls and they're out of the catchment area, we make sure that they get the number and the name of the other case management agency that covers that area. Or sometimes we call on behalf of them. We might do a three-way call or whatever it is, or two-way case, conference call, but we make sure we link them. We never turn anybody away.
But you're only located in New York, or are you in other states? Or
You mean Catholic Charities?
yeah.
There is Catholic Charities in New Jersey and other states, yes.
Okay. Thank you.
You're welcome.
I'm interested in knowing how large is the staff in Bay Ridge and in Bensonhurst? And also, does your organization use volunteers?
Volunteer, yes, but they'll have to go through the main office. But yes, if someone wants to volunteer, they should call the main office on Geralaman. And obviously there's a process. They handle that. And in terms of the staff for this particular program, it's 15 of us, including the administrative assistant.
Between Bay Ridge and Bensonhurst?
The staff, or you mean the amount of clients?
Oh, the staff.
The staff it's only 15 of us in the office.
Okay.
Yeah, roughly 15 of us, yes.
Sounds like you have a big caseload.
It's funny you said that, but not really funny, but yes. The caseload right now it went up a little bit from 65, so it's 72 now.
My God.
So everyone, 10, it's 10 case managers. There's some social workers in between there, and they each have to carry 72 clients.
Big job.
Yes, because as you know, our program, we are case management, so that's where the work is. Because as I mentioned, getting benefits, entitlements, but there may be other layers of issues, eviction notices, they're wanting to move for whatever reason, there may be mold in the, apartment, things like that. So it's not easy cases, but we do our best to try to address situations like that.
On behalf of the community, thank you.
You're very welcome. Thank you too.
It's amazing. There's just never enough.
Yeah, like I always say to some of my co-workers, you walk through the neighborhood, whether it's to get to lunch or you're on your way to a visit for the first time, you just never know what's behind the door, and sometimes behind that door, there's a lot of issues and people are in pain or they're suffering or they need help. So it might look nice outside, a nice facade, that's the point of it, but behind, you have people with a lot of problems layered, there's no such thing as black or white. There's a lot of gray in our in the clientele we work with, which could be for a lot of clienteles, but we have a lot of issues, and I'm so glad I do what I do, so I'm glad we exist.
We are too.
Yes.
Yes.
You help make the neighborhood a better place.
Thank you. We try our
All
best.
of our providers.
Yeah.
Thanks very, very much.
You're welcome. Thank you.
I'm getting the chills from all these presentations. Really, really important. So, we have another agency here, NIA, represented by Senja Ranjapani.
Hello, everyone.
Hi,
How are
Senya.
you? Hi. First, I want to thank you for giving me the opportunity to speak with you all this evening. For those of you who do not know me, my name is Senya Franjapani, and I am the Director of Social Services at NIA Community Services Network, formerly known as the Neighborhood Improvement Association of St. Rosalia. NIA was founded in 1981 by the President, Michael Bove. We started off with one after-school program and one summer camp. We now have our own building located at 6614 11th Avenue in Dyker Heights, where we offer over 45 after-school programs and summer camps across Dyker, Bay Ridge, Bensonhurst, Staten Island, Park Slope, Bell Harbor, etc. We do have some beacon programs as well. Those programs are 6 days a week. And we also have a new program, which is the NYCHA Cary Gardens Cornerstone program located in Coney Island. We work with the local politicians to run the senior proms and picnics, the concerts in the park, our annual Halloween event, along with our veterans event. We offer parenting and family support services, which is geared toward new moms and parenting. I handle the social services aspect at the NIA. I run a counseling program, which everything is free. I also assist individuals and families with applying for government benefits, such as SNAP, Fair Fares, MSPs, health insurance, STAR, SHE, SCREE, DREE, City FEPS renewals, New York City Lottery housing assistance, notary assistance, the list goes on and on. I also offer naloxone trainings as well. And I will never leave any client behind. All services, I assist all boroughs. If I am unable to assist a client, I will get a referral. I will never leave anybody behind. If anyone would like a copy of the NIA brochure, I could put my email address in the chat box, or you can reach out to Josephine or Dorothy. And if anybody has any questions, I'd be more than happy to answer. Thank you.
Karen,
Yeah. I have a very quick question. Hi, Senja. How are you?
How are you?
I'm good. I'm very good. I have very quickly. Many a times we get an aid application, and it is an overwhelming application, and it's filled with things that are way beyond Bay Ridge Care's pay grade. There are things that we cannot address. The issues are so complex that what we could do would just basically put a Band-Aid on the problems. And we do need at that point to refer the person applying for aid to either a Catholic Charities or sometimes to the Center for Family Life in Sunset Park,
Right.
or to another agency. Or is NIA one of those places we might be able to refer someone to? Because they either need assistance applying for other social services like SNAP, like all those other things. Are you one of those places that we can?
Yes, you can. So,
Okay.
you know, again, I only listed a short, services, but there are tons of them.
Okay.
Again, like if they needed assistance with Accessoride or WIC assistance or Meals on Wheels, and anything governmental, you can refer to me. And like I said, I will never leave anyone behind. They will get somebody live. When I refer, I do not give someone a hotline and say to my 65-year-old senior or adult senior, wait online for 3 hours. No, absolutely not. So, but yes, I would be more than happy, Karen, you can refer away.
Thank you so much, because sometimes there's always just like we're at a loss.
Yeah, and it's very bad. Yeah.
Right. And to be honest with you, we are not trained social workers, and I would never want to, I don't want to lead someone down the wrong path.
Of course.
So that's when we turn to the professionals and say, help us.
Right.
So,
Well, like I said, all services to all boroughs. I know we are in a little bit of a dead zone. So a lot of services, I do assist clients on the phone because I know they cannot get to me,
Right.
or virtually, FaceTime, anything that I could do to better them, and make them feel secure. I will go out of my way because let's face it, we all have to be together and we all have to help each other.
Wonderful. Thank you so much for that,
You're
Senja. I
welcome.
appreciate it.
You're welcome.
so I have a question. Listening to your description, it was a little overwhelming.
Yes, I know.
You guys do so much. And not only does it sound like you do so much, your geographic area is endless. So I'm just wondering how you provide these services to the whole city.
With no sleep.
I know, but are you one location?
Yes, we're in one location. I touch about 37 zip codes on my own. So I'm all over the place. Of course, again, a lot of people cannot get to me, so I make it an effort to be able to do virtual or phone sessions. And of course, if they're in my backyard, I will go to them if they cannot get to me and they feel okay with doing that. But yeah, we only have the one main office on 11th Avenue.
So, I heard you say you run all these day camps throughout the city.
Okay, yes, we have over 45 after school programs. After school programs and summer camps. I don't run them personally. Each school has a director. So most of them are free. We do have a few fee-based, but that only happens until we're able to secure funding for that location. And a lot of our camps are free, and if they are fee-based, we do accept vouchers for low-income families.
Wow, you guys are busy.
Yeah.
How large is your staff at the?
I'm sorry, I didn't hear you.
How large is your staff?
My staff, you're looking at her. One, me, I do it all. I have volunteers and, stuff like that. But like, I'm the one who brought the program into the NIA. And, I have a lot of volunteers that work with me. But as far
Superwoman.
as
If people wanted to volunteer, how would they go about doing that?
the same thing, if they wanted to volunteer, they would call the main office and I would put them through to the director of operations, and, they would fill out the application and then go from there.
Okay, thank you.
You're welcome. Thank you so much, everyone.
Thank you. Sandra, do you have a number, a contact, or are
Yes,
you
my
gonna put
dear.
it? Okay, go ahead.
Okay, so you can reach me at 917-580-0028. That's my cell. And you could always call the NIA office, 718-236-5266. And Josephine, is the chat working? I could put my email in?
Yes.
Thank you.
Yes, the chat is working.
Okay,
Thank you.
thank you.
So I just want to share with everyone on the committee that if you're not aware, and for our guests, that Community Board 10 has in the past put together a senior issues resource guide and coupon booklet. It was really very popular pre-pandemic. And in recent months, working with the Bay Ridge Center Aging Committee, we decided to update our resource guide because seniors do like a physical booklet and they really much enjoyed having local resources in one location. And we were very blessed to have an intern who is helping us. So you will be hearing from us and reaching out because we're going to include all of your information in our resource guide. And coupon booklet, we list all of the food pantries in the district, our elected officials. We have any program that, social service related program that services the district both locally and citywide, as well as, helpful hints on Access-a-Ride, on, the new Omni system. There's just, so much that we want to put together in this guide and be able to distribute it to our local seniors. So you'll be hearing from our intern very soon. And before it goes out, we're going to run it by you just to make sure we have all the info correctly that we can share with our local seniors who, make up about 15% of our population. So it really is so important to us. And they're not a monolithic group, so many are aging in place. We're a NORC. We've said this a few times and really appreciate all of your services and are so grateful to live in this community.
Absolutely, I concur.
Yeah, we are very lucky. We're very tight.
That's,
Okay. I really appreciate that the three of you came this evening. And hopefully we'll have a chance to do this again with some of our other agencies. And of course, we'll let you know, you'll be welcome to come back as well. And I was really happy to see that the three of you had some questions for each other. It was an opportunity for your networking as well. And so thank you so much.
Thank
And
you all.
Thank you to all our community board members who attended. So with that, I will say thank you and good night.
have a good night, everyone.